Reflexology is a form of alternative treatment that involves massaging, squeezing, or pushing on parts of the feet, the hands, or the ears, with the intended goal of improving general health of the body. Reflexologists suggest that the body contains an energy field, invisible life force, or chi, and when the passageways for these forces are blocked, healing can be prevented. Some reflexologists claim that they can relieve stress or pain in other parts of the body by manipulation of the feet. As with chiropractic, reflexology relies upon the idea that manipulation of single areas of the body can supposedly affect other areas in beneficial ways. Yet the forces they claim to be influencing and pathways they claim to be repairing have not been substantiated, and seem to have more of a spiritual or religious origin than a physical or scientific one. Initially known as zone therapy, the basic concept of reflexology was first introduced in 1913 by William H. Fitzgerald, an ear, nose, and throat specialist who claimed that applying pressure had an anesthetic effect on other areas of the body. In the 1930s and 40s, zone therapy was renamed to reflexology and further developed by Eunice Ingham, a nurse and physiotherapist. Now, I don't question that methods like these can relieve some everyday stress and make a person feel more relaxed, but some reflexologists, such as Mildred Carter, who was a student of Eunice Ingham, go well and beyond, as she stated in a 1993 mailing from her publisher. She said, "Not only does new body reflexology let you cure the worst illnesses safely and permanently, it can even work to reverse the aging process. Say goodbye to your age lines, dry skin, brown spots, blemishes. With body reflexology, you can actually give yourself an at-home facelift with no discomfort or disfiguring surgery." Even among those who do not claim to do anything more than relieve stress, it can be difficult to understand how they define stress, let alone how they would quantify it to demonstrate the effectiveness of reflexology. You can get a diploma in reflexology with as little as 6 months of home study, and there is no licensing or regulation. To be fair, they do have an alleged code of conduct by which they operate, but it's easy to see how an average person can become a reflexologist without any qualification in other important associated fields of medical training. This can certainly be a dangerous thing with people who are out there promising to cure you of serious illnesses or disease while having no actual knowledge of disease or medicine, and distracting patients from seeing more qualified specialists. Several studies have been done on the various claims of reflexology, one in which 70 subjects were asked to state whether they had had health problems during the previous 2 years in any of 43 anatomical areas. These data were then compared with the findings of a reflexologist as recorded on a report form. The results did not differ from what would be expected by blind guessing. To prevent the reflexologist from asking questions or observing subtle clues, the experimental subjects were asked to remain silent, and a curtain was placed so that their feet were the only part of their body visible to the reflexologist. Another study compared the effects of foot reflexology, simple massage, and conversation on 130 patients who had undergone abdominal gynecologic surgery under full anesthesia. Patients were asked how they felt, and data were recorded on general condition, pain intensity, movement of the bowels, urination, and sleep from the day before the operation until the 10th day afterward. Simple massage turned out to be a relaxing, positive experience, whereas foot reflexology had various effects, some of which were negative. The researchers concluded that foot reflexology is not effective in acute abdominal post-surgical situations in gynecology and can occasionally trigger abdominal pain. Not surprisingly, reflexologists claim to have some studies of their own, supporting their practices. One reflexology website says, "A reflexologist cannot diagnose or prescribe. Also remember, reflexology is an adjunct to medical help, not a replacement for it." However, the same site has a very extensive list of studies done that allegedly show improvements for cancer patients and those with diabetes, kidney stones, impotence, multiple sclerosis, and a host of other ailments. Most of these studies have been conducted overseas in places like China and Korea, and of the ones in the US and UK, you could be hard-pressed to find that they were published in any peer-reviewed journal. I didn't browse the list for long, but I don't seem to see anything but studies praising the effectiveness of reflexology treatment, and not a single one even saying results were inconclusive. Again, it's important to note that even if the studies listed are credible, all it demonstrates is that patients find reflexology to be a comfortable aid in recovery. It does not prove the existence of pathways in the body, chi, or even the effectiveness of reflexology. People underestimate the power of suggestion and the placebo effect, and simply because someone seems to feel a little better during reflexology treatments does not indicate reflexology is what sparked the improvement. Correlation doesn't equal causation. There seem to be studies done on both sides of the argument that have conflicting results, so if anything can be gained from this, it should be that nothing is determined to be conclusive thus far. The realistic benefits of reflexology are more in line with what you could get from a nice massage. It may help you relax, relieve some aching muscles, and might even temporarily lift your spirits a little. But I honestly can't think why a person would prefer a simple foot massage instead of a full-body one given by a licensed professional masseuse who perhaps knows what they're doing a bit more than some reflexologists do. It might be useful if you have a foot fetish, and in that case I guess it could be perfectly beneficial to both the reflexologist and patient. Though if you're looking for a proven, or at least mostly effective treatment for your medical problems, reflexology does seem less like a science and more like a superstition.